What I would love to do is share with you a framework for outcomes and outcome management as developed by our organization, the Rensselaerville Institute. I will do so by sharing first a kind of an overview. It's a PowerPoint presentation. Some of you are probably already holding your head, oh, not another PowerPoint. But we'll try to make this go quickly and energetically. And then after that, you have a handout. And I would love to lead you through just a couple of quick exercises to illustrate what we're talking about. Fair enough? The last time I was in this room, there were, I don't know, a tenth as many people, maybe a little bit more than that. And it was a workshop. I do, 15 or a dozen to 15 of them around the country for Juwan and the Foundation Center. And workshops are my forte. Big presentations are not. So we're going to try hard to make this like a workshop. Fair enough? Great. Great. We got to set the stage here. You heard about Tracy and assessing impact. Sometimes we call it results. A minister dies and is waiting in line at the pearly gates. Ahead of him is a fellow who's dressed in sunglasses, a loud shirt, a leather jacket, and jeans. The keeper at the gate. Oh, you heard it already. Just be quiet. Addresses this man. He says, "Who are you, so that I may know whether or not to admit you to the kingdom of heaven?" And the man replies, "I'm Joe Velarde. I'm a taxi driver from New York City." The keeper consults his list. Now it's on a laptop, so he scrolls down and down. Finally, he looks up and smiles broadly at the taxi driver. "Take this silken robe and golden staff and enter the kingdom of heaven." The taxi driver goes into heaven with his robe and staff, and it's the minister's turn. He stands erect, and in a loud voice he says, "I'm James Snow, pastor of St. Paul's for the last 40 years. The keeper again goes to his laptop, scrolls down, and finally says to the minister, "Take this cotton robe and wooden staff and enter the kingdom of heaven." Of course, he's flabbergasted. "Just a minute," says the minister. "That man was a taxi driver? He gets a silken robe and a golden staff? How can that be?" "Up here," says the keeper, "we work by results. While you preached, people slept. While he drove, people prayed." So now you know why impact and outcomes and results are really, really important. Okay, focus on outcomes and impact. You know, if you really get hung up in the words, we're going to be in a little bit of trouble here. Okay? I'm going to focus on outcomes. Impact, by a lot of definitions, is a bigger subject. Okay? But we'll try to make the link. So whenever people start talking about assessment and outcomes, these are the kind of words that pop up. How do they make you feel? Good? Yeah? Make everybody feel good? No. I mean, pretend the sun was shining this morning. How many of you woke up, yawned, and stretched, kind of peeked out the window, saw the sunshine, and said, "What a spectacular day. I can't wait to get out there and be held more accountable"? You're right. It doesn't generally happen this way. I don't mean to be facetious. These are not bad words, and they're not going to go away. On the other hand, they are words that tend to make us tired. Okay? They stress us out, and if we get tired, we are lost. Energy, as Juwan has heard me say over and over again, is one of the most important factors in the equation for success in virtually any endeavor. So what should we do? Let's start with a different set of words. Helpful? That's where we want to start today. And should you choose to move toward an outcome framework, whose ever outcome framework, for goodness sakes, do not start with an accountability headset. It will set you back. It will murder your staff. It will be death on wheels. Keep it positive. What's my outcome today? I want to do the best darn presentation that I've done in the last 3 years. Good outcome? No, of course not. Okay? Outcomes, and we'll talk about this in just a minute, but outcomes are what's different after I do what I do. Okay? So I have to rely on you to be different. You're the people I can influence. Okay? And when I do workshops here for a full day, I put an outcome up on the easel and pad. And it's very simple. I want people in my workshops to go home and try something that they learned at my workshop and tell me a month from now, A, what they did and that it worked. It added value for them. You know, I could do the whole drill and count how many people are in the room and then set a target for how many of you I think I could change. Okay, influence, if I could say that, with, in fact, only an hour and 15 minutes. And I do want you to use at least some little bit of what you take away from today. Okay, let's talk about outcomes again. Literally, what comes out. We're fond, as you can see, of kind of comparing words, because words are the way we think. And what I try to do in my workshops and what I want to plant the seed of today is that outcomes and assessment and results and impact, if you really take them to heart, cause a different way of thinking. How many of you out there have a job description? And what? Ooh, not too many. Okay then. How many freelancers and consultants do we have in the room? Yeah, okay. So you're writing your own job description. Fair enough. But the classic job description is, in essence, a to-do list. Am I right? It tells you what you're supposed to do. Cross the line from job description. How many of you have a result description? Some of you, I would venture, do. Some of you do. But in its purest sense, a result description might not say word one about what you do and would only, in fact, say what's going to be different after you successfully do what your job description outlines. Database, data use. That's the next one down that I always focus on. If you're the database manager, that whole concept involves an activity. The only outcome of a database is its use. So if you're the database manager and somebody comes to you on your staff and says, I'd like to collect this information and put it in the database, ask the question, what are you going to do with it after we have it? And if you don't get an answer, refuse to collect it. Wow. How many database people are there here? Not too many. If you were in the audience, you'd be smiling at that. Okay? So let's be clear, okay? What goes in, what comes out? Outcome. A different way of thinking. Okay? A different way of thinking. How many of you have an outcome management in place, or system in place, or approach in place in your organizations? See, I think more of you do than think you do. But here's the simple self-administered test. If you can say yes to these three questions, you not only have an outcome framework in place, an outcome management framework, we could call it that, but if you've got all three, you've got a robust outcome framework in place. One, you know how to define success, not in terms of your services. Stop just a minute and think about that. If success for you is delivering 5 workshops, you don't have it. Okay? You got to be able to define success in terms of the results of your services or your activities or your process. You know for sure when success has been achieved. Let's put it a different way. You know what evidence you have to gather to show that success has been achieved, that the change that you're seeking has happened. If you have those two, a positive response to those two, you have an outcome framework in place. If you want a robust one, then you need some way of gauging before your program is over whether or not you're on track to the success you've defined in question 1. Okay? And you need that to be built around this. This is a highly technical term. You need that to be built around the same stuff that your success is defined as. Right? Yes, I know how to define success in terms of the results or the changes, not in terms of my own services. I know what evidence I need to seek to show that success has been achieved, and I can get that evidence. And halfway through, a third of the way through, virtually at any point in the program, I can tell you whether or not I'm making enough progress to get to the success that I've defined. Wow, it got very quiet in this room. When we talk about defining success, in essence, in our lexicon, okay, our glossary, and believe me, the words are not the most critical thing. But we have them like all outcome frameworks. Okay? When we talk about question 1, defining success, what we're talking about is what we call a target. And the tool that we use is, in fact, target setting. Let's talk about targets a little bit and setting targets. First of all, targets look at the gains that come from an activity or a process and not the process itself. Okay? So when I said I want to do the best on presentation I've done in 3 years, that's my activity. That's my process. That can never be a target. If you want to know whether or not you've got an outcome or a target, ask yourself this question after you lay it out. Okay? Who does that? If you do it, your staff does it, your program does it, it's not an outcome. Pretty harsh, huh? Pretty doctrinaire. I have to be that way. You won't believe how many people come to the workshops, and when I ask them to set a target, they still are talking about what it is that they do. Can't be. If you want to assess outcomes and impact, you got to look elsewhere, someplace different than your own activities. Targets are pretty straightforward. X gain for Y people. Of the 125 people seated in this room and the antechamber and the library, at least 100 of them will go back and in the next month try out at least one small thing that they picked up from this session and report that it worked. Added value. Questions? Under the influence of the implementer. The sun is still shining this morning. How many of you rose early, yawned and stretched, looked out the window and said, "It's a great day. I am in control"? Doesn't happen to me very often. Okay? And in fact, over and over again, I hear in audiences like this and in workshops, I don't control that. I don't control my client. You're right. On the other hand, if you woke up this morning, yawned and stretched and said, "Gosh, it's a pretty nice day, but I have absolutely no influence," you better get out of the business. I don't care what business you're in. How many of you have ever been in sales? I hate to tell you this, but you're all in sales. I'm making a lot of assumptions here. I'm making assumptions about the fact that most of your organizations are about education, about health, about social services, youth development, okay? And whatever it is you're doing, you're trying to convince somebody to do something that you believe would not happen without your intervention. You're a salesperson. And there's no shame in it. You're trying to persuade somebody to change their behavior, their condition, their status. And you don't control it. But I hope you influence it. So when we set targets, they should be set in accordance with our level of influence. Right? I don't quite know what to do with an hour and a quarter's worth of influence and one small handout and 125 people. You know, but if I got half of you, it might be a realistic target. If I got 75, it might be a stretch. And there's one other point that's going to kind of vitiate this whole conversation, because somehow I got to figure out what's the evidence. And I'm not sure I even thought about this yet. Good targets are set relative to a baseline. But if we were in the process of setting a target which has both a condition or a behavior or a status and has a number, okay, then we need this concept of what's a realistic number, okay? And I get that question all the time also. And so what we introduce is this concept of a baseline. Now, we're not talking about a baseline of individual behavior. We're talking about a programmatic baseline, like what kind of result did you achieve with last year's program? Excuse me. Well, I don't know. This is a brand new program. What does another high-performing organization like yours down the street achieve? Well, I don't know. We're unique. Okay. What does the national literature say about programs like this and what they can and usually do achieve? And after you run through all of that and you can't get an answer, then in fact, and this happens all the time in my workshops, then in fact I look somebody right in the eye and I say, George, what do you think you can make happen? Wow. And I left one out. There is one other baseline. It's called the no program baseline. What would happen to this same group of people that you're serving or this same situation if nobody did anything? Well, people scratch their heads. Can we find that information? You bet you can in a lot of places. I have one wonderful little organization that publishes every year what they call a result card. I'm sorry I didn't bring it with me. But it looks like a little elementary school kid's report card. And you open it up and it says not one word about what program they do. It just lists the results. Fabulous fundraising tool. Fabulous. Okay? Not only that, one of the results, I have it memorized. Last year, 67 of our teenagers who had been arrested went 6 full months after our program without a rearrest. Cool result. Not only that, but given the New York State statistics about recidivism, I can then tell you how much public money I saved based on the cost of incarceration. Okay? So, what did you achieve last year? What does another high-performing group achieve? What happens if nobody does anything? Personal commitment. What do you think you can make happen? Okay? Remember, we're talking about targets here. And the last point about good targets, they represent clear commitments. Oh, John, that sounds like accountability. Not the same. Okay? That question that I just asked George, okay, is what we mean by clear commitment. Good targets can't be a fond aspiration of hope. Because they represent clear commitments, they are motivators. In fact, those people with targets are much more likely to achieve them than those who pledge best efforts. Okay, target setting. Now there's an element of target setting that we didn't talk about, but here are the characteristics of a good performance target. Okay? They're about behavior or condition. They have a degree or a quality associated with them. There's a pair of women toward the back to whom I introduced myself. They told me about themselves. They run a domestic violence program. Okay? And in fact, they were talking about quality in terms of results. And I said, not only do good targets or good results have quality, but they have a number associated with them. In fact, an organization I worked with in San Diego, California, some number of years ago had a wonderful mantra when it came to results. No numbers without stories, no stories without numbers. You might want to remember that. Right? But these are the characteristics of a good target. They're about behavior, condition, status, and not yours, your clients or the people that you serve. They have a degree or a quality. They are verifiable. That's the step that I did not put in. That's question 3. What's the evidence that you can see and that somebody else could see? Okay. Doable with a stretch. That's our notion of not setting the bar low. Oh, but John, if I set it too high and I don't make it, the foundation will cut off my hand. Okay. I hope not. If they do, refer them to us, and we will work with them. If you look at one of our old mission statements, it said something like this. We help 2 kinds of groups and individuals and organizations. Those with the money and those who want it. Okay? But I'm serious. We have a book of business with hundreds of nonprofit clients and probably 100, or approaching that, maybe it's more now, of foundations. Because an outcome framework has much of the same elements, has many of the same elements for a foundation as it does for a nonprofit. They don't want to know, okay, what activities they do. I'll talk about that in a minute. But what they want to know is what results their money bought them. Bound in time, when will these results occur? A number, and if in fact you are using resources from somebody else, the people that we call it now investors, okay, your results have to connect to what they're trying to achieve. If you're the county executive of Albany County, New York, where I live, his name is Mike Breslin, and you happen to look at the teen pregnancy statistics, and you say to yourself, oh, that's really high. We got to lower that in the next 5 years. And you start making grants, then the grantees had best deliver results that at a minimum contribute to the reduction in the teen pregnancy rate. Fair enough? Okay. One other thing. Behavior, condition, I'm giving you a narrow definition. Okay? Built on education, health, and social service examples. But think more broadly. Did a lot of work with the Environmental Protection Agency, okay, around clean water. Long and short of it is, the targets are about a change in water quality. Right? Turns out a lot of those changes could be facilitated by the behavior of people. So you could go either way in those kinds of things. But if you're talking about advocacy, for example, okay, it might very well be a change in policy or practice, or all the way out at the end of advocacy, a law. So keep your thinking broad, but keep it narrow in the sense that it's not what you do. It's what happens, what change occurs based on what you do. My job many times involves helping people make tangible in one way or another what you consider to be intangible. I would urge you, just for the heck of it, to go look at the guidelines for the Altman Foundation. The Altman Foundation. Guidelines for grants to the arts. Okay? And they've done an awful nice job of actually talking about the kind of results that they might like to see from arts organizations. Okay? Great. Let me keep going.
Can you spell that? What was the alternate?
ALTMAN. Go on the web and look them up and look for their grant guidelines.
They had the president here speaking about a month
Earlier?
ago.
Karen wrote?
No, it was actually Jane O'Connell.
Oh, okay. Great. Let's make this animated again. What is that? That's a to-do list. Am I right? Well, not quite. Because in the nonprofit world, we upgrade that concept and we call it our project work plan. Right? And the problem is, at least as I see it, many organizations use this to manage by. Why do you mail the program brochures? That's right. Aha! You now have the answer to question 3. Okay? That you have a mechanism built on the same technical term stuff that targets are built of, the behavior or condition of your clients. Okay? But you have a mechanism now for knowing whether you're on track to get to that performance target, which read something like, of the 40 people who actively engage with our program, at least 15 will control their anger toward their children for at least 3 months. Okay? Great. Oh, I have targets and I've got milestones. Thank you, Juwan, because you came. Nobody's throwing anything yet. You liked it. I may need some mechanisms for figuring out whether you got it, and I have one already. Okay? I count nodding heads. Okay? A month later, you remember it. You tried it, and it worked. Now, I have to figure out, and I'm not sure I'm going to be able to do this, and I want to be right up front about it. I don't have all your email addresses. If I did and I really wanted to do it, that's the mechanism that I would use to verify. I would use a client self-report, okay, to ask you a month from now whether you tried something. In fact, I'd ask it differently. What did you try? So you have to be specific. And how did it add value for you? And you know what? If I had you for a week, I'd change your life. Pretty arrogant, huh? I'm sorry. Okay. More powerful than great plans. More effective than a big committee. More useful even than a lot of money. Human spark plugs. This is how we generally try to end, I think this is the end, any discussion that we have about outcomes and about managing outcomes and about the programs that you implement to get outcomes. It depends on the people, okay? You've got to have spark plugs. People with a bias to act, a results orientation, energy, personal responsibility. My quotes are back there, but I have one. Okay? This is not to denigrate teamwork or teams, but we are clear that it takes individual personal energy. Anybody know who David Ogilvy is?
Yep. Yeah.
Okay, Ogilvy and Mather?
Yeah.
This is David Ogilvy. Search your parks. Search your cities. You'll never find statues to committees. Okay? And, you know, there's a wisdom there, and it's the same wisdom that we learned 35 years ago when we got our nickname, the Think Tank with Muddy Boots, when we had actually purchased a small town outside of Punxsutawney called Stump Creek, Pennsylvania, and together with the residents embarked on a 5-year program to put sewage and water into that community because when we bought it, there were 50 homes and 50 outhouses. And what we learned was that without the presence of a spark plug, you're going nowhere in community development, in community renewal, and for practical purposes, it's hard to get anywhere in any kind of an endeavor without that human spark plug who encompasses and brings life to things, mostly with human energy.
Put that back up 1 more second, please. Priceless.
For shame, Joanne, I should have put this into the packet instead of the... I'm sorry?
Isn't that the definition of success? I mean, whatever that success is.
You know what this is? Pick up almost any book on entrepreneurialism, and you will find this as the characteristics of an entrepreneur. You know, most of us think of them as wild risk takers. They're not. These are their characteristics. And the only risks they take are ones that they think, not control, that they can influence. Okay. You want to try this? Try it. But understand, you're going to make a couple of mistakes along the way. Let's leave this up there. Okay? Go to your handout. Probably page 2, because I think the first one was a cover page. Okay? Think about something that you're engaged in right now. If you have a single purpose organization, you can think about the organization. If you have an organization with multiple programs, think about a discrete program. And let's create a performance target. All right? First thing I want you to do is think about the people that you are serving in this program. Your clients or your customers. I hope that's the first empty box. I would like you to just jot a couple of notes about the characteristics of those clients or customers. Or, if you're not doing education, health, the arts, or social services, okay, or any other program in which you're working with individuals, then jot a couple of notes about the present situation that you're trying to change. You've only got 20 minutes left, so don't carry. If it takes too long to write it, just think about it a little bit. Okay? Now let me give you a little demonstration here. I borrow you, Hector. Would you stand up? Hector and I are both your customers. What do you see? Two bald-headed men, okay? I got a tie. Okay? He doesn't. Okay? He's taller than I. Usually, you fooled me. I thought you were way big. Yeah. Okay. Okay. So that's something we have in common. He's okay. Do those characteristics make a difference?
Yes.
Depending on what you do, let's change it. Depending on what you're trying to achieve. Ooh, ouch. Okay? Depending on what you're trying to achieve. So if I had judged you right, and you were literally 2 feet taller than I, and I was running a basketball camp, does that count? Yeah, it might. Okay? We're doing a drug and alcohol program. You don't need to know about us in terms of whether I got a tie on or not. You need to know whether, when was the last time I relapsed? Okay? Do I have a family at home that supports me? Here's the guideline for your client description. Talk about your clients or customers or those you serve in terms of the characteristics, stay with me on this, that make it more or less difficult for you to get to success with them. Good?
Can you repeat that?
Talk about your clients and their characteristics in terms of those characteristics that make it more or less difficult for you and your program to get them to success. Hey, let's go to question 2. 20 minutes we got. What kind of change do you want? Be careful here. Okay? Don't put a number in there yet. Here comes the technical term again. That's the stuff of the change. I want improved academic performance. I want improved poise and self-confidence from my artists. I want somebody to be employed. I'll stop. Okay? In step number 1, that first box on the left, just write the kind of change or behavior or status. Thursday, I'm going to go work with a group in Westchester County. Among other things, they have a citizenship program. I want citizenship. Right? Everybody got it? Okay. Now go to the next box. This is degree or quality. I'm sorry. Adopting my workshop mode and scrolling down. Okay, I'll stay right here. Okay. I can move? Great. Degree or quality. I want improved academic performance. Yeah? As soon as I hear improved, increased, decreased, what's the question I ask? By how much? Okay? I want my students to improve by at least 1 letter grade. I want them to read at grade level. I want them to get a job and keep it for 3 months. I want them to get a job that has at least partially paid employee benefits in a skill arena in which they are trained, and I want them to keep it for a year, and it's got to pay at least $9.50 an hour. Anybody do any federal workforce development work? That sound familiar? That's the kind of results they're looking for, folks. You can't say, got to get a job. I'll give you a little hint. Get a job, that's a milestone. That's a progress point on the way to keeping it. Okay? So make some notes about degree or quality. Put it all together in a statement that says, of the blank number of people that we will serve this year, blank number will change, and then take your information from steps 1 and 2 and put it in. Did you do it? You have a performance target. The next time you write a grant, right, if the foundation came to us for help, they're going to ask you a question about what you propose to achieve. And when they do, give them that performance target. Fair enough? We're not quite done. We're not quite done. How are you going to know? I have 2 granddaughters, okay? 10 and 8. I introduced them to Ghostbusters. Now I say, who are you going to call? Ghostbusters, they say. Now I say to you, How are you going to know? How are you going to know? We call it verification. And by the way, we do not call it evaluation, and we don't even call it measuring. Those are common terms in the outcome movement, and they're just fine. But the place we start with people is verification, because it is a much simpler process. It's essentially, simple is the wrong word, but it's a straightforward process. Okay? It's finding the evidence to give a yes or no answer to this question. Did you achieve your target? How are you going to know? And my staff's going to look over their shoulder when the kids are doing their homework after school. Is that valid? Yeah, it's valid. If I said they're going to improve by at least one letter grade in school, I'm going to get their report cards. Is that valid? Yes. Absolutely. They got a job and they kept it for 3 months. I want to see their pay stub, or I want to talk to the employer. They've developed more poise and self-confidence. I'm the director of the show. I'm going to rate that. Is that valid? Yes. Yeah. How valid? Oh, don't ask me about that. I did not do well in statistics. These terms about validity and reliability, they roll around in my head a little bit. They're good terms, and I'm not dismissing them. But when we start, I would propose that you worry less about validity and reliability, okay? And worry more about whether or not you're verifying at all. Because if you don't verify, don't bother setting targets. Don't project results at all. Okay? I often do this little thing, there's no easel pad, I didn't ask for it, but I outline a continuum, okay, from weak to strong. And it's the verification continuum. And what I tell people is you want the strongest possible verification methodology that you can afford. Because believe me, folks, it costs money and time. And sometimes people in my workshop say, John, if I do all of that, I'll have no money or resources left to work with my clients. And you can't let it get to that. But if you want to do the outcome thing, if I could be so flip about it, you got to verify. Milestones are those lists, very often done in sequence, best done in sequence, so they can follow along with time in your program. Milestones are that tool which actually lists interim behaviors or conditions that are signposts on the way to the target. All kinds of names. One of my colleagues calls it a results trail. And the milestones are the trail markers. I don't care what you call them, but what I do care about is that you get a couple of key, here's an important word, predictors. Good milestones predict that you're going to reach your target. Okay? Now, she's going to be aghast when I tell her that I said this. But my wife, Nancy Rocca, runs a preschool for special needs in the Albany area. It's a big old one now, and she's been the executive director for 25 years. She's got 3 sites, 15 classrooms, 65 people working for her, and I don't know how many kids with special needs. But even with all those people, she relies on volunteers. So her volunteer coordinator actually has a target for the number of volunteers that she needs to recruit and keep. Right? 20 volunteers who volunteer regularly at least 4 hours a week for at least 3 months. What's the behavior? Volunteer. What's the degree or the quality? Regularly, 3 times a week or 4 hours a week for at least 3 months. What are the milestones? They show up. That's great. Okay? I'll tell you the milestones. They call for an appointment. They pass the background check. Preschoolers, remember? Okay? I'm doing this in sequence. They demonstrate skill and agility. If they can't get down on the floor and roll around with preschoolers, opportunities for volunteerism are limited at the Early Childhood Education Center. Okay? They come for the first session. They sign a contract. And they get to the target. Okay? Why come to the first session? Because about a third of them drop after the first session. Oh, the noise, the confusion. You can make it through the first one. That's kind of a prediction point that you're going to go further. Simple example. How many milestones do you need? 30. No, poppycock. How long is your program? 2 months. 2 or 3 good milestones. How long is your program? 2 years. Probably better have a dozen milestones or 10. Why? Because they're key to time. If you wait too long to look for progress, you will have lost the opportunity to course correct back there at the start. I'm getting that affirmation you're nodding. Take 3 minutes and jot down a little set of milestones for yourself. Great. Take it home. Use it. Try it out. Share it with staff. Don't go full bore. If you're new to this, take it a piece at a time. If you want to share it with staff, don't share it with the folks you're trying to fix. Pick the low-hanging fruit. Bias for success. The question was, we gave you an example and we just worked through something that was a discrete program. How would you take that in a larger agency and try to kind of aggregate it up to show some, it's not quite impact, but to show some outcome connection to mission is the way I would put it. Okay? One way to do that, one way, and that's a hard question, by the way, it's a hard thing to do. But one way to do that, and I've seen this in community action agencies and community centers, and even in some family serving agencies, is to build what I call, and these are my words, I don't think you'll see them a lot of places, a result architecture. And in many ways, it's a construct. But let me give you the example of an outfit that I worked with up in Bridgeport, Connecticut, which was a multi-program social service agency, community center kind of place. And when you asked them, they said, what are you all about? We're all about self-sufficiency for the residents of this city or this neighborhood. Then I asked, what do you define as self-sufficiency? And here's where they build the architecture. They simply say, you know, if a family here is self-sufficient, there's somebody with a good job, there's a roof over their head, the kids are in school and doing reasonably well. There's no dysfunction or minimal dysfunction. There's no alcoholism, drugs, whatever, kind of no domestic violence or limited or however you do that. And then essentially they simply call that self-sufficiency and then count the number of people. And maybe they say, you know, if somebody has 4 out of 5 of those characteristics, they're self-sufficient, then they count the number of people over time that they can move to that position. I made it pretty simple and logical and straightforward, but that's a terrific question because the more convoluted you get, and frankly, the more fuzzy your mission statement is, the more difficult it is. In fact, if I were to put on that chart of what goes in and what comes out, word mission, it would often go on the what goes in. Think about your mission statement. If it says to something, it's going to be followed by a verb, usually the verb that says what you're going to do. I prefer to have a vision statement or an outcome statement that in fact said, listen, if we were wildly successful, what would our clients look like? It's sufficient. That's all I got. Actually, I got 3 minutes. You got a question? The question was whether I had an opinion about, for example, Charity Navigator or GuideStar or any of those kind of organizational rating systems that are used to rate you nonprofit organizations. Yeah, here's one opinion. Okay? The first one is that in the past, they missed the boat because all they did was look at 990s and finances and staffing to some extent. Going forward into the future, I can tell you that they are all working on outcome frameworks to build that into their mix. GuideStar, in particular, is working with us. And that's the way it's got to go. Okay? The donor wants to know, by and large, what kind of results you're getting.
Are you familiar with GiveWell.net?
No.
GiveWell, they are the newest rating agencies for nonprofit. They rate based on their impact, on how well they demonstrate their impact.
Okay. Terrific.
Fantastic.
The world's going that way.
Sorry, what was the name? GiveWell.
GiveWell.net.
.net.
GiveWell.net. Terrific.